The next time you sit down with your doctor, there's a good chance 3 little letters are going to come up. PSA. And a lot of men aren't ready for that conversation. They think it's a simple yes or no test, like checking your blood pressure. So they either agree without really understanding what they're agreeing to, or they wave it off without knowing what they're waving off. I want to make sure you're not either of those men, because the PSA test isn't a simple pass or fail. It's actually a decision, one that reasonable doctors and reasonable patients weigh differently. And you deserve to walk into that appointment able to hold your own in the conversation. So let's get into exactly what the PSA test is, the honest case for it and the honest case against it, and the specific questions to write down and take to your doctor. There's no pressure in either direction here, and nothing waiting to be sold to you. By the end, you'll be the most prepared man in that waiting room. A quick word before we dig in. I'm not going to tell you to get this test or to skip it because honestly that depends on you, and only your own doctor can weigh it properly. What I can do is make sure you understand what you're actually deciding. Let's start simple. PSA stands for Prostate-Specific Antigen. It's a protein that your prostate naturally produces, and a small amount of it circulates in your blood all the time. The PSA test is just a blood draw that measures how much there is. The idea behind it is straightforward. Prostate cancer can cause that protein to rise, so a higher number can be an early clue. And that's genuinely valuable because catching an aggressive prostate cancer early, before it spreads, is when it's most treatable. But here's the very first thing you need to understand, and it's the thing that surprises men most. A raised PSA does not mean you have cancer. That same protein goes up for completely harmless reasons. The normal age-related enlargement of the prostate raises it. An infection or inflammation raises it. Even certain activities in the days before the test can nudge it up. So a high number is not a diagnosis. It's a flag that says, let's look closer, nothing more at that stage. And there's no single magic cutoff where one number means fine and the next means danger. Your doctor reads that number in context, your age, your history, your prostate exam, how the number changes over time. That's exactly why this is a conversation with a professional and not something to interpret off a printout at your kitchen table. Now let me give you both sides fairly, starting with the real argument for getting screened, because it's a good one. Prostate cancer is common in men as they age. Most cases are slow, but some are aggressive, and for those, finding the cancer early can genuinely save a life. The PSA test is the main tool we have for catching it before there are any symptoms at all, because by the time aggressive prostate cancer causes symptoms, it may already be harder to treat. Large studies show that screening men in the key age range does reduce prostate cancer deaths to some degree. So for the right man, this test is a real chance to catch something dangerous while it's still very beatable. If you have a father or brother who had prostate cancer, or you're a black man, both of which carry higher risk, that argument gets stronger, and the conversation is one you'd want to start earlier rather than later. That's the honest case for. It's not nothing, it's a real potential benefit. But I promised you both sides. And the other side is the part that usually gets left out, and that's the reason so many men feel blindsided later. Here's the catch. Most prostate cancers grow very slowly. So slowly that many men would live a full, normal life and die of something else entirely, never knowing the cancer was there and never being bothered by it. The problem is, the PSA test can't tell the slow, harmless kind from the dangerous kind on its own. It just says elevated. And so a raised PSA can set off a chain of events. First, more testing, often a biopsy, which means taking small samples of the prostate, and that can carry its own risks like bleeding or infection. And if a slow-growing cancer is found, one that may never have caused you any trouble, it can be very hard emotionally to just leave it alone. Many men choose treatment, and the treatments for prostate cancer, surgery or radiation, carry real potential side effects that can affect quality of life, including urinary control and sexual function. So the honest concern is this. For some men, screening leads to finding and treating a cancer that never would have harmed them, and they end up living with side effects they didn't need. Doctors call this overdiagnosis, and it's the single biggest reason PSA screening is a genuine decision rather than an automatic yes. I'm not telling you this to scare you off the test. I'm telling you because a man who understands both of these sides makes a real decision. A man who only hears the first side doesn't. So how do the experts sort this out? They don't give one answer for everyone, they tailor it. And knowing roughly where you fall helps you have the conversation. For men at average risk, the major guidelines suggest starting the conversation around age 50. The years where the decision matters most are the late 50s to 60s, where there's the clearest balance of potential benefit. For men around 70 and older, most guidelines lean away from routine screening. Not because your life matters less, obviously, but because prostate cancer is usually so slow that the test is less likely to add years and more likely to lead to treatment you didn't need. Though if you're a healthy 70-year-old with many active years ahead, that's a real discussion to have too. And for higher-risk men, a family history of prostate cancer, or Black men who face higher rates and earlier disease, the guidelines suggest starting these conversations earlier, sometimes in your 40s. Your overall health and how many active years you reasonably have ahead matter just as much as your age on paper. Notice the theme. There's no universal rule. There's your situation. That's the whole reason the appointment matters. All right, this is the part I most want you to have. Here are the questions to actually write down and bring with you so the decision is truly shared and not just handed to you. Grab a pen or just pause and screenshot this. 1. Based on my age, health, and family history, do you recommend I consider PSA screening, and why or why not? 2. If we do the test and the number comes back high, what would the next steps be? You want to know the whole road before you start down it, not after. 3. What are the chances the test leads to more procedures, like a biopsy, and what do those involve? 4. If we found a slow-growing cancer, would we necessarily treat it, or is careful monitoring an option? This is a big one because active surveillance, watching a low-risk cancer closely instead of rushing to treat, is a real and increasingly common approach. 5. Given my overall health, how much is this test likely to actually benefit me? And 6. The simplest and most powerful. What would you do if you were me? Those 6 questions turn a passive test into an informed decision. That's the whole goal. One more thing so you're never blindsided. If you do get screened and the number comes back higher than expected, do not panic and do not assume the worst. Remember everything we covered. Enlargement, infection, and other harmless things raise it too. Very often the next step is simply to repeat the test, or to wait and recheck, or to look at other factors before anyone even mentions the word biopsy. An elevated PSA is the beginning of a careful conversation, not a verdict. Men have put themselves through weeks of terror over a number that turned out to be a harmless prostate doing harmless prostate things. Don't be that man. Ask what it means, in your specific case, and let the process work. Let me talk to the fear underneath this, because for a lot of men, the whole topic of prostate cancer sits in the stomach like a stone. Here's the perspective I want you to hold. Prostate cancer, when it is found and does need treating, is very often highly treatable. The outlook for most men is genuinely good. And the entire point of understanding this test is to take control of the decision rather than having it happen to you. Whether you decide to screen or not to screen, doing it as an informed choice with a doctor who knows you is the strong and sensible position. You're not helpless here. You're the decision maker. This video just hands you the information to decide well. So if you remember nothing else, remember this. The PSA test is not a simple yes or no. It's a decision with real benefits on one side and real trade-offs on the other. And the right answer depends on you. And if you write down just one question to take to your next appointment, make it this one. Given my age, my health, and my family history, is this test right for me, and what happens next if we do it? Ask that out loud, and you've done the most important thing there is to do here. Your doctor is the one who applies all this to you, so bring the questions and have the real conversation. Here's what I really want to know in the comments. Did your doctor walk you through both sides of the PSA decision, or were you just handed the test? Your answers tell me a lot about what men are actually going through. If this untangled a confusing topic, a like helps it reach someone else searching at midnight. And if you want the groundwork underneath it, the video on what the prostate actually is and does is the one to watch next.